Good morning, everyone. It is 10:12 on Thursday, August 21st. We'll start the 988 Technical Advisory Board meeting. We'll initiate a roll call to establish quorum. We'll start with Dr. Bowie.
Present.
Sherry Simwelski.
I'm here online.
Thank you, Sherry. Diana Gutierrez.
Here.
Ametria Sidney.
Online.
Thank you, Ametrius. Jeff Hebert. Tracy Gonzalez. Jennifer Kenton.
Present.
Aaron Riley.
Present.
Serena Lewis.
Here.
Dr. Raflayan.
Present.
Lon Nguyen.
Present. Online.
Thank you. Joe Sullivan.
Present.
Terry Galvan. I believe Terry was still commuting in, so she may join us late. Jamila Fields.
Present.
So we've established quorum, and we'll recognize Terry if she shows up late.
Back in the 80s, there were so many rumors about...
All right. So our next item on the agenda is the approval of the minutes from the May 2025 meeting. The minutes were distributed to the 988 Technical Advisory Board members prior. Has everybody had a chance to review them, and are there any edits or comments to the drafted meeting minutes?
I have an edit on section 4, subsection B on the Accessibility and Equal Access Working Group report. There's a line about the working group, the group would like to possibly create a graphic or educational materials to offer. So we would love to do that, but what we had talked about was if there's capacity at the agency to do that, or if, I guess reading this, if there's possibility for further support for the work group to be able to accomplish that.
Okay. Sammy, did you catch that edit? Okay. If we can update the meeting minutes from there. Any other edits or comments on the meeting minutes? Okay. Do I have a motion to approve the meeting minutes with the edit from Dr. Raflayan?
Motion to approve the minutes.
Do I have a second?
Second.
Thank you. I'll conduct a roll call vote on the meeting minutes. Dr. Bowie?
Yes.
Sherry Simwelski?
Yes.
Diana Gutierrez?
Wasn't here last time, so I think I'll abstain.
Okay, thank you. Ametria Sidney?
Yes.
Jeff Hebert? Tracy Gonzalez? Jennifer Kenton?
Yes.
Aaron Riley?
Abstain. I also was not present.
Serena Lewis?
Abstain as well. I wasn't present.
Dr. Raflayan?
Yes.
Lon Nguyen?
Approved.
Joe Sullivan?
Yes.
Terry Galvan? Still not here. And Jamila Fields?
Yes.
So we've got 8 votes, so the motion passes. The minutes will be adjusted, approved, and then posted online. Thank you. Our next item for the agenda is public comments for matters on the agenda. Do we have anyone from the public wishing to make a comment on any of the agenda topics? Do we have any acknowledgement online? Okay, online. We have one person who's requested public comment. Go ahead.
Thank you. Good morning. My name is Cassie Dibble, and I'm making my comments on behalf of ACLU Disability Rights Project and ACLU of Northern California regarding agenda item number 8, when the board will consider the 911 to 988 transfer guidance document. We appreciate that this is a new system and the processes to implement it may be novel to many. That said, we want to raise 2 concerns. One, recommendations for call transfers should distinguish between small jurisdictions in which over-the-phone 988 services may be the only alternate option to 911, and larger jurisdictions that have or should have mental health crisis teams to respond in person. 2, new systems such as this should embrace broader public input, especially from people with direct experience with mental health crises and responses. First, the draft 911 to 988 transfer criteria only makes sense when it is applied to jurisdictions that have no alternate crisis response teams. For example, the draft criteria blanketly prohibit transfer of any call made about someone, quote, not known to the caller, even where the caller is reporting a perceived mental health crisis. But this exclusion would make no sense where a local jurisdiction has crisis response teams available through 988 equipped to respond to such incidents. We strongly urge the advisory board to clarify that the draft policy's prohibitions would apply only when no alternative crisis response teams are available to be dispatched in the field. Jurisdictions that do have crisis response teams can and should develop more expansive transfer criteria. Second, there has been remarkably little transparency and opportunity for the public to submit feedback specific to the formation of these draft criteria. The public has been excluded from the 911-988 interface working group meetings, despite, for example, a representation at the May 15 advisory board meeting that the working group would host an open meeting in late June or early July. Very little information has been made available about their work other than a draft of transfer criteria dated March 19, 2024. We accordingly ask the advisory board to delay taking any action to adopt or finalize any transfer criteria until it has provided adequate public notice and opportunity for input on this critical aspect of the board's work. Thank you for your consideration.
Thank you. Is there anyone else from the public wishing to make public comment for matters on the agenda? All right. Thank you. Our next item on the agenda is our legislative update. We'll invite Paul McGinnis up to the corner, and he'll provide an overview of legislation.
Thank you, Paul. Good morning. My name is Paul McGinnis, Legislative Coordinator for Cal OES. I'm going to run through a couple key legislative dates that are upcoming, as well as 5 state bills and 4 federal bills that we are tracking that would be of interest to the board. So the first date I'd like to share is August 29th. This will be the last day for fiscal committees to meet and report bills to the floor. About 2 weeks after that, September 12th is the last day for the legislature to pass all policy bills to the governor's desk. And then October the 12th is the last day for the governor to act on all bills that are put on his desk. Unless there's an urgency statute on a measure, January 1st will be the date that the statutes take effect, January 1st, 2026. So I will now run through just a few bills briefly here. First is AB 330, Assemblymember Rogers. This bill would extend operation of the Local Prepaid Mobile Telephony Services Collection Act until January 1, 2031. This bill is currently on Senate third reading. AB 470, Assemblymember McKinner. This measure would require CPUC in consultation with Cal OES to establish a process allowing carriers of last resort, to be relieved of service obligations in unpopulated or well-served census blocks. The bill requires CPUC by December 15th, 2026 to adopt a map of well-served areas. The process must include notice and challenge provisions, and carriers granted relief must meet defined requirements during transition periods. This measure is currently in the Senate Appropriations Committee. Next bill is AB 645. This bill would require a public safety agency that provides 911 call processing services for emergency medical response to provide pre-arrival medical instructions to 911 callers that are requiring medical assistance. That is Assembly Member Carrillo, and the measures on Senate Appropriations Committee as well. I forgot to mention too, this list will be made available to the board following the meeting, so everyone can review these bills. Next, AB 654, Assembly Member Coloza would require the County of Los Angeles to establish a homelessness resource telephone system to receive telephone calls regarding individuals who are experiencing or at the risk of experiencing homelessness in order to provide those individuals with resources. That bill is currently also on the Senate Appropriations Committee. And the last state bill I want to share is AB 727, Assembly Member Gonzalez. This bill would, commencing on July 1, 2026, require public schools that serve pupils grades 7 through 12 and public institutions of higher education that issue ID cards to additionally have printed on those ID cards the telephone number and text line for a specified LGBTQ+ suicide hotline. This measure is also on the Senate Appropriations Committee currently. I'll now briefly run through 4 federal bills. First is H.R. 540, the 911 Saves Act of 2025. Would require the Director of the Office of Management and Budget to review and make certain revisions to the standard occupational classification system with regard to public safety telecommunicators. This measure is on the House Committee and Education and Workforce. Next, H.R. 2937, Protect 911 Act, would require the Secretary of Health, HHS, to improve the detection, prevention, and treatment of mental health issues among public safety telecommunicators. That bill's in the House Committee on Energy and Commerce. Next is S290, would direct the Secretary of the Interior to upgrade existing emergency communication centers in units of the National Park System to the Next Gen 911 systems and for other purposes. Currently in the Committee on Energy and Natural Resources. And the last bill is S666, First Responders Wellness Act. This measure would increase access to mental health, substance abuse, and counseling services for first responders, including public safety telecommunicators, and also for other purposes. So that concludes our bill summaries for this meeting. I'm happy to take any questions the board may have.
All right. Thank you, sir. No questions from the board. I appreciate you coming today. Next item on our agenda are the working group reports. The Technical Advisory Board will provide feedback on the working group's activities. The first one up is the 988 911 Interface Working Group Report. Jeff A. Bear and Tracy Gonzalez are not present today, so we have no report out on that. For the Accessibility and Equal Access Working Group, Dr. Bowie, Dr. Rafalayan, do you have an update?
Yes, we do. Let me go first. The Accessibility and Equitable Access Working Group met on July 31st. Since the Technical Advisory Board last met in May, we have now 3 new members of the work group, and we are still continually recruiting. Just so to summarize for the board, that our work on the work group is related to focusing on equity issues, on topics such as 911, 988 intersection, areas of accessibility and need for additional tools and resources so that we could promote equitable access to 988 crisis services for all Californians. At the last meeting, we talked about a number of groups that needed some additional tools and resources, in particular LGBTQ+ young people. I'll give a further update on the subnetwork discontinuation. We also discussed needs for the deaf and hard of hearing community. One work group member raised in particular that folks who call 988 for the deaf and hard of hearing subnetwork are connected to crisis centers located in Minnesota and Virginia, and therefore the question has to do with what kind of local resources can we connect Californians to were they to call that subnetwork. And then there's a population that has some concerns about privacy and data protection, and that would be the autism in intellectual developmentally disabled community. We also talked about how we need to work on accessibility on our own state websites, particularly for those who are visually impaired or have communication difficulties on our websites. So those are some topics I raised. Maybe let me turn it over to Dr. Rafla-Yuan for other topics.
Thanks, Dr. Bui. So that was pretty comprehensive, and I'll add a couple more details on particularly the concerns around the data privacy and the quality of services. So 988 is kind of an interesting program because there's a state and federal partnership. But right now, we've been hearing in a lot of the communities that we work in, the various work group members, that folks are a bit worried about contacting some type of government service right now with really kind of private or crisis-related concerns. This has been a little bit of an ongoing concern, so we had brought that up at one of the prior advisory board meetings, and was hoping to see if there was some sort of follow-up on what the state's viewpoint of data collection and ownership is, and if we're able to have a public-facing document or press release or some sort of item that we can point people to when they're concerned about, well, am I protected? Is my information going to be used against me in some way later down the line? And right now, there's just like, it's kind of vague in terms of when people look at the website or things like that for that type of reassurance.
If I may add a specific ask for the board from the work group, we've raised this before as well, would be if there are any particular assignments that you could give to the work group so that we could focus on any particular deliverables. For example, if there were equity and accessibility concerns out of the 911 988 interface document, I think this is an area that the work group could facilitate, a public involvement process or feedback from particular communities who are more disparately impacted by these services or need more equitable access. So that's an example. I can give a little bit more ideas later in my update out of the AB 988 5-year implementation plan, but yeah, if there's anything that you can think of from the board to give assignments to the work group, I think we would deeply appreciate that focus.
And we would be very happy to support the 988 911 interface working group, because one of the concerns that we heard in public comment and that other members of our work group has raised is that when these guidelines go out, how are they going to be applied, especially in different neighborhoods and different zip codes for people who speak different languages, for people who are deaf or hard of hearing? Are these really going to be able to make sure that everyone gets high quality services, no matter who they are and where they are in California?
Thank you. Any comments from the board? All right, thank you. Our next working group is the 988 Implementation Working Group. I apologize, Terry Galvan did step into the room. We did have quorum established prior to Terry showing up, but I do want to recognize for the record, thank you, Terry, for joining us this morning.
Thank you, and my apologies for being late. So we have established the 988 Implementation Working Group, and we have met 2 times. And we have several members, including Cal OES, NGA, some of the centers, to participate. We have established our purpose, which is to operationalize and track the stages of implementation for the unified platform and CRM system for the California 988 crisis centers. Our focus is not on the individual pilot programs that are starting, because Cal OES is managing those wonderfully. It is more to look at the implementation of the entire system for the 988 centers. Throughout this process, there were a lot of different points of feedback, a lot of conversation about what the system overall needed to have to be operational at implementation. And so this work group is now creating action steps to look at how was the feedback incorporated into the system, how was that feedback loop back to the centers who maybe provided feedback, and to just close a lot of the loops, because this has been a very long process. So some of the people who started are no longer there. There's been new rounds of feedback. So this group is really just trying to bring all of that together and be a group that can help streamline and clarify this conversation.
Thank you, Terry. Lanwin, you're online. Do you have anything to add to the working group report?
Yes, and Terry covers most of the important subjects or areas that were discussed in those 2 work group meetings. The other thing that I want to mention is that at the last meeting that we have on August 8, most work group members share the importance for feedback between COES and NGA to the 988 crisis centers, either through emails or newsletter or whatever format, that if let's say if COES and NGA asks for a survey about something or ask for suggestion about something, and when crisis centers send those feedback or their ideas about surveys and so on, is that they receive an acknowledgement that their submission information were received, and if there was any questions or concern, and that NGA and COES also acknowledge the importance of providing regular communications and updates about the implementation of the 988 platform.
All right, thank you. Any comments from the board related to the 988 Implementation Working Group? All right, thank you. Our next item is going to be a Cal OES 988 report. Here are the topics that we're going to discuss today in the update. And I'll start. So from the 988 911 branch update perspective, since I've been appointed as the 988 system director, I've really looked at what our requirements are in Assembly Bill 988. What are we legislatively required to deliver immediately? At the same time, working with our partners at DHHS and DHCS, and how can we support the overall 988 community? And from the legislation, the 988 Technical Advisory Board has 3 specific deliverables. We have the feasibility and planning for sustainable interoperability between 911 988 and behavioral health crisis services. Then we have the technical and operational standards for the 988 system to allow coordination with the California 911 system. And then we have the standards and protocols for 988 center call transfers to 911 and vice versa, 911 to 988. And I know there's been a lot of work been put into these documents. And the way I've read the legislation is the working groups should be put together to help drive the office and provide the feedback to the office to develop these documents. So what we are going to do is I'm going to actually have my team take ownership of these documents and work with the working groups to get the feedback, draft these documents, and then provide them in advance to the Technical Advisory Board prior to our meetings. So when we do meet, you have something that you've had advanced review of, you can provide comments to. And Dr. Bowie, I would like to further discuss how we can use the relationships between all of these working groups to develop the feedback and really drive the development of these documents. We've been embarked on this journey for a few years, and I think refocusing this will help us apply greater success. I do know Dr. Bowie, in partnership with my team, was able to visit the Sacramento Police Department's dispatch center here recently. And the Sacramento Police Department shared some of their, I think their pilot projects for 988 to 911. So they've shared those documents. And what we want to do is do some outreach to the other centers statewide, see who has either enacted policies or pilot policies that we can take, and how can we blend these into more of like a state level document, shape it up, get the feedback from the board, and then drive to the overall development of these documents. And I'll pause really quick for any questions related to these activities.
I have a comment. So am I on? Okay. So our center is here in Sacramento and part of that pilot project with Sac PD. And so I did a sit-along right after you were there, I believe. One of the things that I think it's worth noting here is that many of our jurisdictions are asking us to move much faster than this process is going. And so I don't know if there's a way to have interim guidance or best practice, because at least from our perspective, as you said, you saw documents that we've created absent having something that from you all to us in order to do this. And that is, and as these pilots are taking shape and we're building them out, interest grows and other entities are interested. And so it feels, from my perspective, that our pace is a little misaligned as far as the guidance that you may want to provide to us that's not getting incorporated in these first round projects.
Thank you for that. I think what I heard you say, and I really want to summarize this to make sure I understand. Local agencies are advancing a little faster than maybe the state is. Is there benefit in creating relationship locally between the local public safety agency dispatching and our 988 centers? Do we already have good working relationships there? Or is there something that we can do to help facilitate some of the communication between the local center and the local 988 centers? So if somebody is advancing policy faster, at least there's more advance notice and advance coordination. Does that make sense, Terry?
Well, somewhat, but I will say any help is appreciated. If that answers, yes, you're correct that everybody's moving along at based on different demands from their various cities and counties, and they're moving at a different pace and a different understanding of when all of the promise of 988 was supposed to be realized. And I mean, there's several levels to that, and a lot of the interoperability is not exactly there yet because we do not have the system in place that we are imagining is going to help with the data collection and the interoperability and the way that it's going. And so I think it really is just a mismatch of pace right now.
Okay. I'll go back and talk to my team and then my leadership about some ideas I have that might be able to help bridge that, and then I'll present that back to the board.
I have a clarifying question. And this is what I'm kind of stealing. I'm the newest person here probably. So I'm Chief Deputy Director Lisa Monget from Cal OES. You know, the success of the 988 system, right, is based on coordination, right? And we're not necessarily at a point of service, and Cal OES is focused on the technology side of it, program drives, technology. And so I just want to make sure that I'm understanding what your concern is. When you talk about guidance, is it programmatic, is it guidance in terms of the technology aspect of it? Or is it a combination of both from like the programmatic guidance from the state and also the technology? Okay.
Yes, it is both.
Okay.
Yeah.
That's helpful.
Oh, sorry to interrupt you.
That's okay. And then I can take that back to our partners at the Health and Human Services Agency also. I know that they're very focused on this program, and so I want to make sure that it doesn't come to us from like a technical aspect of it, but it doesn't really provide you the kind of support that you're really looking for, right? And you're kind of there on the ground at the point of service where your jurisdictions are conveying their expectations and what they're hoping to see.
Yes, and we were one of the centers that made a calculated decision a while ago to not upgrade our system because we knew the Cal OES system was coming and we didn't want to train and retrain. And now at this point, with us not having the system and not having an adequate system, the technology is, because our system is fairly antiquated compared to what the future is demanding. So we're in this spot of having to bridge that as well. That is pure technology.
Yeah, thank you.
I would love to just echo everything that Terry said. This is Sherry. I'd like to echo everything that Terry said and even maybe add a little bit more color to that. I think it's definitely, there's technology that we need to be coordinated on. There's policy that we need to be coordinated on. There's also trying to manage expectations of stakeholders, especially given that there's not clarity how this piece of the system is supposed to be funded. It's easy to consider that perhaps, these are just calls that come into the 988 system like any other call. And so, they'll be counted like any other call. And to some degree, that's correct. However, it's not entirely correct when we're still not yet receiving funding to take all of the contacts. And also there's staffing that is required to support these relationships at the PSAP level. And especially, for example, for D.D. Hirsch, we've got, I'm not even sure the exact number, but I know it's over 100 that we cover in all of the counties that we cover. And so there's a lot of on the ground work that's needed to develop these relationships and to maintain these relationships and to train all of the dispatchers. So I think there's a lot of pieces of the puzzle that haven't really come together effectively. And I think, it's because there's stakeholders that need to be involved, perhaps even broader than this group right here, in order to do that. And I think, it's interesting because on the one hand, in our communities, we'll have, we've got some PSAPs, sheriff's offices in different counties that are like, we're ready to start sending you stuff right now, which is great, although we're not quite ready to receive it. And then we also have PSAPs that we encounter where they're like, they're not even willing to do this in this moment because they feel like perhaps that there's liabilities or challenges or there's union questions. And so I think the reason why I bring all those last issues up is because I think that there's, some conversations that perhaps could be had at a higher level, which I think is what we're supposed to be doing here, so that we're not having to negotiate all of these things, individually with every single PSAP. And I'm not sure, we've gone to some of the conferences. We went to the NENA conference. We're hoping to go to the Cal NENA conference. But I'm still not sure if we're really getting the message out. So I know I just said a lot of things, but I agree with Terry that there's a lot of momentum on the ground in some communities for this to move forward, and yet we still, at least I feel like we still don't have all of the pieces in place to implement this effectively.
Thank you.
Thank you, Sherry. Are there any other comments from the board?
If I may add one piece, and I think I appreciate hearing about the various local innovations and solutions that have been happening likely for years, right? And I think we're such a large state that it really is going to be, I'm just trying to think of what we can do at the state level. And one of the things that we've started to do is to really learn and highlight and get experience, whether they're lessons learned or advice or templates of MOUs and things that you've been doing locally that works for your community. And I think at the state level, I'm just thinking right now as a medical professional, thinking about what are the potential solutions that are out there for various communities, and what are the variables that contribute to the success of these local solutions that we can then extrapolate and understand at a state level. What are these, and can we kind of collate all these examples together for the different geographic and demographic diversity populations that we have, and go, okay, these are the lessons learned, these are the templates that people have used, these are, so that you don't have to, if you were going to try this in your community, you don't have to start from scratch. You can learn from someone that's gone before. So I feel like, in a way, yes, the state is trying to catch up with what's happening locally, right? But we also have a large state, and we could do this in a systematic manner and centralize the resources in a way that people throughout California can access and learn from each other.
Thank you, Dr. Bowie. Any other comments? Yes.
I think that's a great idea, Dr. Bowie. It's Sherry, and we'd be happy to help contribute to that at D.D. Hirsch. We've done some of that already because we do have such a variety of partners that we're trying to partner with. So we'd be happy to, work on that with you all.
Jennifer Kenton here. From a PSAP side, I know that in our county, some of the frustration that we've been dealing with is that the community is demanding, but they know 988 is out there. They want those services. They don't want police responding to certain kind of calls. But everyone in our county has been waiting for this board to push out, right? Because I've been telling them in the county, we're getting this document together, come join the working group, all this stuff, and we've had the document. And we're trying to get to 100% to meet every group, that I feel like we may need to look at pushing out some very generalized guidelines, because people are starting to do it. San Jose PD has a partnership with our 988 center. They're transferring calls. Our 988 leadership is meeting with our managers group in the county, advocating for us to start transferring calls, and they're making their own way for us to make it possible to do it. And we're drafting a document for our agency right now to start doing it, because we just don't want to wait. We want to meet the community's needs. And I am all, like, I believe it's so important. I love hearing about all the accessibility group, thinking of all these things that I may not have thought of, but For now, we need to start offering these services, and I feel like so many PSAPs are hesitant to do it until the state says, okay, here's our vetted guideline. But in the interim, we're not giving the services that are there, right? And do the calls help with the funding as well, the call volume? So if we're not transferring those calls, is the money going to come into the 988 centers from, not getting the call volume? I don't know. But that's kind of the PSAP frustration, I would say.
Yeah, thank you. So as you,
this is
go ahead,
Lon
Lon.
Nguyen from 988 from Seneca County. Thank you, Jennifer, for sharing that. It is correct that the Seneca County 988 has been working with our local 911 partners to develop as much as we can based on what we know from the general guidelines draft at the state level work group. But yeah, I also agree that we can't keep waiting to make sure that we got 100% on our proposed protocols, because regardless, whatever the 988 911 work group develop, it would be suggested that we use that as a guideline, as a proposed guideline, and locally we would need to tailor, use this guideline, but tailor to our own local level for our own use. But just keep waiting and keep revising and taking more, suggestions and so on. It'll never be perfect. Even after it's been adopted by this board, I don't think it'll be a perfect document. It will be continuing to be a fine-tuned working documents. So it's important that we approve this, and then the local 988-111 use it as a suggested guideline to develop their own guidelines to meet with our local needs.
Thank you, Lon. Any other questions or comments from the board?
One, I guess two comments. I was heartened to hear the kind of efforts that you're thinking of taking the documents more on the agency side to help accelerate the process and build opportunities for stakeholder feedback. And then the second one is just kind of echoing the need for this out there. So there are many places that are doing it well, and there are some places that are not doing it very well. So including in San Diego County, where the county and some of the cities in the county are having disagreements over who's responsible for what. And so some of these transfers are just like not happening. And so the guidance would really help provide guidance in these situations.
Yes, thank you. So as I was hearing some of the comments, one of the other benefits of this board is we have Jamila Fields from POST, the Peace Officer Standards and Training Agency. And she is responsible for managing the facilitation and training of dispatcher training. And if I said that wrong, let me know. She's an important person in this conversation. I believe there's already been some training about 988 in the post and in the dispatcher world. So I think some of this, we've pushed the cart before the horse. And I think some of the work that we're going to do to help push this along a little bit faster will help us catch up. So I think we've got a few things that we can work on between a communications plan, some more coordination with our state partners, and especially with our post partners, to make sure that whatever we develop, post is able to review and see how are those training courses being developed, and are they considering what this board is providing and recommending as transfer policies and interoperability policies. So more work for you, Jamila. All right. So our next update is going to be on the 988 call handling system and CRM status. We are still working in Buckalew currently. They are only ingesting their local lines into the 988 system. We have been working with SAMHSA We're doing some additional testing. SAMHSA has requested on the Vibrant platform to validate some interoperability there. But that pilot continues to go. We continue to work with Buckaloo on that. And then on the Vibrant side, they have agreed to deploy 988 calls as a pilot into Buckaloo and just confirm interoperability. And our engineering team is working with Vibrant now to do that last testing. We don't have a solid date yet of when that's going to occur. We were hoping that would happen by the end of August. But some updates to the MOU required a little bit more testing, and the engineering team's working through that now. So I'll pause for any quick questions there.
I have a question. So with the 988 being live in certain agencies, is this just primarily live with PSAPs and not like medical or fire department or anything like that?
So very good question. 988 is live at each of the 988 centers in the state. They're taking 988 calls today. What the state's platform will do will provide a unified platform for all centers statewide, and then it will work to ensure interoperability between 911 and 988. And legislatively, we're required to maintain that interface between 911 and 988. Regardless of technology answering the call, we have to be able to transfer those calls back and forth. There are some limitations in legacy 911. In NextGen 911, it will afford us a greater opportunity to move calls throughout the state. I use the example of if we have a 911 call in San Diego that needs to be transferred to a 988 center in Los Angeles. Today, in the legacy world, we have limitations to transfer it that far. In the future, in NextGen 911, we'll be able to move that 988 call anywhere it needs to go. So if for some reason 988 services are not available in Southern California, we can move it to another center throughout the state. Is a policy overflow and alternate route. It is those policies get further developed. That'll provide us more depth in coverage of the 988 system. Does that answer your question? Yes, Terry.
Can you speak a little bit about the plan for text and chat? I know that when we speak, we always say the calls or the line, but it's helpful for everybody to start saying calls, text, and chat, especially as that is really largely our future, is being able to handle text and chats exactly the same way we're handling calls. And so maybe you can speak to how that pilot's going or what we're doing with the text and chat.
So text and chat currently are going to be using the Vibrant text and chat platform. We have some 988 centers that have not started taking those text and chat, and we're working with them to deploy and start taking. And as a part of the FCC update, I'll give an update on some good work happening at the federal level for text. But yes, I can't remember the number. For some reason, I want to say it's 10 of the 11 centers currently not taking text, but we are working to get those deployed.
10 of the 11 not taking text?
Nope, I'm sorry, the other way around. 10 taking, 1 not taking.
Okay.
I believe is the number.
That might be. And then when I was at my sit-along, had a demonstration of how if the police and fire needed to transfer their text stream to one another for that continuous process, that they were able to do that. Is that being built into this system, where we will also be able to do that at some point in the future?
So that work was just added to the Vibrant MOU, the SAMHSA MOU. In our last iteration, it just came back to Cal OES with the requirements to do further text testing. So that will be work that our engineering team does with Vibrant to ensure that ability to have full interoperability between 911 and 988 on text as well. I believe Ryan Sunahara is our chief engineer for the 988 side of our house. I believe chat has limitations because it's IP-based. Text operates differently and can be transferred. Did I say that properly? Yeah, so the chat does have limitations, but that's inherent to the technology. In our 911 centers currently are not using chat. They're using only text to 911, which is capable of being transferred around. Any other questions? I just want to make sure I answered your question. Do you need further clarification?
No, that was fine. Thank you.
Okay. All right. 988 surcharge. As we spoke at the last meeting, in June, we start the budgeting process to establish the 988 surcharge. So in June, the office reaches out to all of the carriers. The carriers are required to deliver their access line data in the month of July. So what that means is AT&T Wireless, they do an analysis of their network, and they say in the state of California, we have X amount of customers. Verizon have X amount of customers. We collect all of that data, and that gives us the part of the formula to be able to establish the 988 fee, and also on the 911 side. The other part of the formula is the budgeting process for the state of California. So throughout the year, the state budget is established and it's formalized at the end of the fiscal year. The budget is approved, and in July we get what's called a fund condition statement, and in there shows our budget authority for, in this case, DHHS, DHCS, and Cal OES. What are our budget authorities? And then we total that number up to establish how much budget we have. And then we take a look at the carryover from previous year. And here is a sample of the calculator that we use. So at the top line, this is our authorized expenditure. That's how much budget authority we have. And then the next line is how much carryover do we have from the previous year. And then the third line will show how much revenue is needed to support that budget authority. Then we add in how many access lines are being reported to the state of California. And then we adjust the dollar amount down in the surcharge line to establish how much revenue is needed, and that sets the rate. So all of our access line data has come in. We had one carrier was reporting what we felt was wrong information, so we had a couple of days where we were going back and forth to confirm the information that they've had. We were able to get that confirmation done on Monday afternoon. So all of our access line data is in, and the team is now building this calculator and getting that set for review. What we will do is we will draft our recommendation for the rate set and then send that through the Cal OES executive team, which has to be reported from Cal OES to the California Department of Fee and Taxation by October 1st. So we'll draft our letter, make our recommendation on the 988 as well as the 911 fund, and have that reviewed by executive and then sent over to CDTFA. So I'll take a quick pause. Again, the numbers on this screen are samples, as when we built this, we didn't have confirmation of any of the data. Our next slide here is the actual fund condition statement for current fiscal year. So is everybody comfortable with the fund condition statement, or should we walk through this again as review? And I know the screen is makes it very difficult to see.
I think it would be great to walk through it again.
Okay. So we're going to be talking about the far right column on the screen here. So at the top is our beginning balance. This is carryover from prior year. There were no adjustments for this prior fiscal year. So as you work down the document, it'll show the revenue projected to be brought in by 988. So that top number, we show a $45 million carryover. The next line, we show a 44 million revenue generated from the 988 fund. And then the total transfers and adjustments, that's the total of what we should have in the, that's the total resources, transfers, and other adjustments. And then down below is the total resources for 89 million. And then down below, we have the expenditure report. These are the state agencies who have authority to use the Setna fund. And if you total all of those numbers down, you have the total expenditure line, which is $62 million, and with a projected fund balance of 28 million going into future year. So what we need to do is take a look at the total authorized budget of 62 million. We'll put that into that calculator, validate whatever our access line data is, the carryover of the 45 million, and then adjust the fee to find out how much revenue is needed to be collected to support 988 operations moving into this current fiscal year. And as a reminder, the 988 fee is established on calendar year. So our budgeting process is July 1 to June 30. The 988 fee is adjusted January 1st through December 31st. So I'll take a quick pause for any questions.
I would love to kind of repeat back what I'm hearing and have you stop me when I'm saying something that's wrong, if that's okay. I just want to make sure I'm processing all of this, and I'm wondering if there may be others who are needing to process it all too. Is that okay?
Yes, go ahead.
So you're saying that you all, Cal OES, will be recommending the surcharge rate in October that will be set in January for next fiscal year. Is that did I understand that right?
No. So we make the recommendation in October for the Setna rate to be adjusted in January.
Right. For what fiscal year?
So the rate is collected for calendar year, and it supports both current fiscal and future fiscal year.
I see. Okay. And how do you come to the rate that you're going to recommend? Is it just based on the numbers that are listed in this? And I suppose at what point or what process is there to assess whether or not the rates that are in this chart, the numbers that are in this chart, meet the needs?
So this is the budget process approved by the California State Legislature. These are the budget authorities provided to each of the state agencies that have access to use 988 Setna funds. So this budget has been approved. This is what the governor's budget is for the next fiscal year. So we have to establish the rate collection to support this budget authority.
So this budget authority is already set, and it doesn't move. It can't change for the next period.
Maybe I can help, and then Paul can edit me as needed. So the rate catches up with the budget that's established. So the rate that we recommend in October. So the law requires that we make a recommendation to the CDTFA body by October 1st. That rate is a function of what the current revenue projection is, which is based on the number of carriers, and the delta between that and the budget authority that was approved by the legislature and signed by the governor and included in the budget that took effect last July. So the rates catch up with the actual budget authority. The rate itself, so there'll be this notice that goes out. What Paul is saying is that the rate itself will not take effect with the vendors until January itself. At that same time, every year, right, a governor is developing his or her budget, which will then be released as part of the Jan 10 budget. So we're always collectively as a state looking at what budgetary needs are. And in order to adjust the spending authority, there would need to be another budget proposal that's included in the budget that would take effect July 1st of next year. So the budget authority is really critical, and that's what drives the rates. When we, and I'm sure I'm speaking for, I suspect the same is true for our Health and Human Services partners. When we make a budget proposal, or perhaps they can make a budget proposal, right, a budget adjustment, one of the conversations that always comes up in these fee arenas is they always want to know, what do we think is the projected impact to the fees? And that would be the cost of any budget proposal. So that conversation also happens through those spring budget discussions. I'm hoping that is helpful.
Yeah, that is very helpful. And I guess I'm wondering, is there transparency what underlies the line items in this budget that's being shown on the screen right now?
Well, there would be, in that any budget adjustments for any of these departments presumably would have come through some sort of budget adjustment, whether it was a budget change proposal that was generated by the executive branch, or if it was something that came from the legislative side, because they're really kind of the keepers of budget authority, and it would have been in a budget bill at some point in a budget discussion. So we're kind of, when we're determining the fee, we're really kind of on the back end of those discussions.
Mm-hmm. I see.
And so, for example, if we were to have pursued an increase in our spend on the Cal OES side, we would have presented a budget proposal and discussed that in a public forum with the legislature. And the same would be true of the other state agencies that are included there.
Mm-hmm.
But if there's something specific that you're wondering about, and then this budget document here, I assume is the fund condition statement that is really governed by the California Department of Finance, which is the state's control agency that oversees budgets. And so this would be a pretty standard fund condition. You see the number up in the top right, 3414. Each fund, a special fund, as this one is, has a particular designation, and the Department of Finance does this reconciliation. So this is not Cal OES or HHS or any of these other agencies. We don't generate this. It's really kind of governed by the Department of Finance. And this is also posted on the website, on their website. But I want to quickly acknowledge that doesn't mean that it's really, it's very helpful to do a walkthrough. And that's why we're doing this walkthrough, because just to see this without a walkthrough is not necessarily helpful.
Do funds ever move between state agencies if they're underspent in one area and more is needed in another area? For example, I'll be completely. Oh, go ahead.
That can occur, but that would require an action likely of the legislature. Mm-hmm. But I will say this: at this time of year, this goes for this year, every agency, and every year. This is the time. So the California budget cycle right now, as we're meeting and talking today, each agency across the state is thinking about what their needs are across all of their respective programs and having conversations. Each agency is then required to develop their analysis, and then they will be having a conversation with the Department of Finance, who is the governor's fiscal advisors, through the fall. So through now in the fall is when the executive branch, all of those agencies, are working through their respective processes to determine what are the financial needs to achieve whatever is necessary for whatever program, right? And then January 10th will be when the governor releases the budget, his budget plan for the following year, which will be discussed during the spring. So that's also an important part for you to know kind of where we are in the budget development process. And that's always where we are in the fall for the state.
Thank you.
Sure.
Okay. Any other questions? All right. And just as a reminder, at the end of this board, we'll finalize the slides and get those posted up on our website. They'll be available. So if you can't clearly see the fund condition statement, you'll be able to get the slides and look at it from there. Okay. An update from SAMHSA. We met with SAMHSA a few weeks ago and just kind of talked about our initiatives here in the state of California, in the initiatives from the federal side. And from our meeting, I believe that we're still aligned. SAMHSA is very supportive of what we're doing here in the state of California. We had our partners from HHS and DHCS on the phone with us. And we approached that from an entire 988 discussion in the state, not just from a technology perspective. SAMHSA is still supportive of our work here with the MOU. We had sent the MOU back to SAMHSA with a few minor grammar edits. They've reviewed that. They've acknowledged and approved all of our grammar edits, but they came back with one technical addition for text to 911 testing, more interface testing there, which our engineering team is actively working on. I'm working with our Cal OES legal to get the final review of the MOU, and hopefully that will be the last round of edits for the MOU, and we'll be able to move that forward. As I said, Vibrant has agreed to route on a pilot project to support 988 testing in the state of California. We continue to push for that. Right now, we want to continue the text testing that is required, and the team's working on that. We don't have a definitive date when that'll all be completed. Right now, I think they're still working on that interface, and there's a control document that all the vendors have to understand the technology to interface the systems and to be able to deliver and move those calls and texts back and forth between the systems. And then a bit of good news coming out of our Federal Communication Commission partners at the federal level. In July, they adopted rules to geo-route text to 988. Previously, if you remember, they approved the geo-routing of voice calls, moving from area code routing to actually geo-routing. Text to 911 is now going to have the same. The benefit there is if you're a resident of Sacramento and you have a 916 area code and you travel to Denver, Colorado, and you need 988 service, if you called 988, you would be recognized that you were in Colorado, not in Sacramento, and it would route you to the local center in Colorado where you need services. In text to 988, that hasn't caught up yet. So if you were in Colorado and texted 988, your text would be routed based on area code, and you would likely end up over in Terry's shop. So they're correcting that, and I believe the timeline is 18 months to get full implementation for the carrier to be able to do the geo routing. So that's good news for us. That's going to help our community get into the 988 system and get help where help is really needed. And I think this is the first step. Although the geo routing is not as precise as it is in 911 routing, it does get us close. And I think this is a good first step for us. So I'll take a quick pause for any questions or comments. Online, we have a question.
Yeah, I was just curious. Thank you for that update. I was just curious if there's any new projections for what a timeline might look like for rollout past Buckaloo for other centers?
So we're working with Vibrant on their additional requirements for text right now. We had some like general timelines. We were hoping to bring on a second pilot here at the end of August, early September. We've had to pause that because of the additional testing Vibrant wants us to do. So no, I don't have anything other than as soon as we're done with our Vibrant testing, then we'll be able to get further clarification.
And are you guys exploring anything in terms of including mobile crisis response modules in the new system?
I believe DHCS, Dr. Bowie, correct me if I'm wrong, I think DHCS is leading up the mobile crisis response conversations based on some of the meetings that we've had.
That would be the services on the program side, but I believe the question has to do with the technology.
That's right, Dr. Bowie.
So if you remember, we stopped the RFP on mobile crisis response teams until we got more formal direction on who was going to be dispatching and who was going to be providing the mobile crisis response teams. So as soon as those are developed and formalized, then our procurement document is ready to go and we can re-release that contract.
I see. I do remember it being paused, but I wasn't clear what the reasoning or what the progress was on unpausing it.
Okay. Any other questions from the board?
I have two questions, Paul. The first one is on the second bullet, Vibrant will support routing and calls to the state platform for the pilot testing and training period. Paul, are you able to? And I know that this might be difficult to estimate, but is there a way, or can you provide a rough estimate about the timeline for those? Because I think we look on NAD centers, we have to prepare staff and volunteers and so that they know when this is coming, and we have to work this into our planning process and all that stuff. So do you think that might be able to happen sometime this year, or would it be probably next year?
I would hope we'd have it this year. Again, it's all going to be dependent on the testing that we're conducting with Vibrant.
Okay. And then the second question is the FCC ruling July 24 this year will adopt rules secure routing to text to 988. Locally, when changes like this happen, even though it's positive changes, we have to develop local educational campaign to inform the community about these changes and the impact and so on. And you mentioned about 18-month implementation earlier. I mean, is that just an estimate, or do you have a sense of when will this actually be implemented?
So I'm trying to remember the analysis my team gave me, and I think if I remember right, Lon, they have 18 months to implement, but it doesn't mean that they're going to take 18 months. So Verizon may implement by the end of next week, AT&T may implement by December, and then T-Mobile might implement sometime next year and still be within the guidelines of this ruling. Does that make sense?
Yes, yeah, it does. I'm just trying to figure out, I mean, when and how to best inform our local community about these positive changes, to the system. I guess we know what we know for now, and then we'll learn more along the way. Thank you, Paul.
Yeah, I've not heard anything out of the carriers how much time they need to develop this technology. I would assume they're doing it with voice calls now. It should be, I say easy, I don't want to diminish the work that's required, but it seems logical that it should not be much for them to do, but that's the carrier side. I can't speak for them. All right, the next item that we have is our update from Health and Human Services. Dr. Bowie?
Thank you so much. All right, here's a brief agenda of what I'll be covering, highlights from our 9/8 crisis project. And then hopefully I can have some input from you on potential implementation activities toward our equity goal. Just want to emphasize that our ongoing work, more than 3 years now into nationwide 9/8 implementation, so Cal HHS, DHCS, and our departments at Health and Human Services really are focused on making sure that we have a high quality 9/8 crisis services for all of California. And so to that effect, we are really focused on supporting our 9/8 crisis centers in terms of meeting the demand from the community, as well as securing ongoing sustainable funding so that 9/8 centers can staff to provide the services that are so necessary and life-saving. We do need to ramp up chat and text capability, as you may have heard referenced earlier. California does answer the highest 9/8 contact volume in the country. The demand is about 500,000 contacts per year. Last fiscal year, California centers answered for over 430,000 of those contacts. But that's still really at about 84% in-state answer rate for 9/8 calls, and only about 25 to 29% of total chat and text coming from California. The rest actually go to national backup centers, of which there are 17 centers that provide nationwide chat and text backup, 2 of which are actually centers in California. However, it does mean that we have a large proportion of folks from California contacting 9/8 that don't get the opportunity to get connected to local resources. So that's part of the work that we're trying to do, is thinking about 9/8 as an entry into the crisis care continuum. Although 98% of the calls and contacts are resolved during the contact itself, there is a small and significant and high acuity level contacts that do need connection to mobile crisis, crisis stabilization, and ongoing connection to care so that people don't have to re-experience crisis again. So that's kind of still the crux of our focus. I just want to highlight a few kind of cool things that have been happening in the last few months for you to celebrate a bit. You may have heard already that in June, SAMHSA announced the discontinuation of the National 9/8 subnetwork that has been serving LGBTQI+ young people. That service was established in late 2022 until July 17th. It served over 1.5 million contacts nationwide. You should know that about 10% of contacts from California did choose Press 3. So it's a small, again, significant amount of 9/8 help seekers. About 5,000 calls per month and 2,000 chat and texts per month did go to this national subnetwork. This subnetwork had 7 centers nationwide, one of which was the Trevor Project. And the Trevor Project did answer all 3 modalities, phone, chat, and text, and they served about half the national volume. So what does this mean when there's no longer a national Press 3 option? That meant that our local California centers have been preparing to absorb this increased volume. We partnered with the Trevor Project in order to really prepare for this change. It's a pilot partnership, the first in the nation, where the Trevor Project will help assess the needs and develop tailored training in order to enhance cultural competency for our crisis counselors to answer the needs of LGBTQ plus young people on top of the required training that they already have. This is very exciting for us. We used our one-time equity training fund. We did not use the 9.8 fund for this. So we're very excited about this. And at the end, there's a great video from Secretary Johnson to LGBTQ plus young people in California about the fact that we are listening, we are hearing the needs of our young people, and we are working to provide the services that they need. Okay, a few other things going on about communications about 988. September is National Suicide Prevention Month, as well as World Suicide Prevention Day on September 10th. The National Suicide Prevention Week this week will start on September 8th, which is also 988 Day. I believe this is the second 988 Day nationwide, right? Awesome, okay. There is a toolkit that SAMHSA has put out. There's a lot of things happening that our local 988 centers can tell us more about. We don't yet have a statewide campaign, but DHCS is collaborating with Advocates for Human Potential, the state 988 administrative entity, to launch billboards and ads during September, promoting 988 during Suicide Prevention Month. There's some really exciting, fun things, I feel like, cross-state agencies as well. We're working on 988 with each other. So the California Department of Tax and Fee Administration reached out to DHCS because they're doing a internal campaign on You Make a Difference to highlight emergency services, 911 and 988. So there's a lot of cool stuff happening within the state as well. And as CDPH, the Department of Public Health, will also have resources for this September Suicide Prevention Awareness Month, as they do every year, and the website is linked there. Okay, one other cool thing to update you about, we talked a little bit about mobile crisis. We don't know a whole lot about the state of mobile crisis currently, since we've launched the Medi-Cal Mobile Crisis Services benefit. There are now 52 counties with that benefit across California. But we don't know a lot about other kinds of mobile crisis teams, including co-responders team, including alternative crisis response team. So we are partnering with a research team out of Columbia University, Wayne State University, and New York Psychiatric Institute. They did the first national survey that was published back in 2023 with funding by SAMHSA. This second survey will, again, survey mobile crisis programs nationwide, but they will also provide a deep dive into 5 states, including California. So we're pretty excited to partner with this team to broaden our understanding of the different types of mobile crisis programs in California. So the survey will launch this fall with a goal of having a report out by the end of this fiscal year in June 2026. And we'll get a summary for California in particular. So we're excited to get this information coming. All right, I think that's just my quick highlight before the discussion. Any questions about the highlights? All right, hearing none. I just want to, sorry, went too fast. So last time, I believe I presented on the AB 988 plan. It's huge, it's 140 pages, so there's a lot to go through. So I just thought this time, since we have some questions about equity activities, I just want to highlight what's in the plan and then ask for your feedback in terms of what can we do to operationalize some of these activities that have been proposed. So just as a reminder, the AB 988 5-year implementation plan has 4 kind of stated goals around public awareness, around infrastructure and technology, around making sure there's high quality 988 crisis response, as well as integration of 988 into the crisis care continuum. And underlying all of that are some cross-cutting goals having to do with equity, data, funding sustainability, and use of peer support. So I just want to focus quickly on the equity goals because they're kind of fairly focused, and I'm wondering if we can get some headway in putting these into actions. So in terms of equity, really what we're focused on here is to make sure that there is inclusion and equity for services for populations that might be at elevated risk of suicide crisis and behavioral crisis, those that need adaptive tailored services or other kinds of uplift in order to equitably access these services. Some of the things that we were able to identify together among state entities as well as community partners was looking at the development of a dedicated Native American 988 line akin to the model in Washington State that was elevated by our California tribes as well as many interested community partners. So that was something that we put in as something that we ought to really explore. I understand there's some local conversations happening now that we need to think about, but I just want to bring that up as trying to figure out how to think about this, certainly from a technology standpoint. And then the second activity having to do with looking at linguistic translation and language access standards. Cal HHS and our departments have done some updating of language access standards, so we can look at those, and I'm wondering if there's an opportunity for us to think through this as a technical advisory board in terms of how do we improve access to 988 services for those communities whose language of preference is not English or Spanish. So those are two very focused activities I just wanted to get some feedback on. As a background, there are a few other equity-focused activities, but they don't have Cal OES listed there. So I just thought I'll provide those as background so you know there's some work going on in other parts of the plan having to do with both communication and awareness about 988 and engaging populations of focus to make sure that we tailor public messages in a way that's accessible to them, as well as engaging trusted partners and CBOs to promote awareness about 988. There's a number of things that we want to do in terms of making sure there's training standards that include cultural responsiveness, language access, as well as other activities having to do with privacy standards and things like that. But again, they didn't list Cal OES, although you're most welcome to weigh in on those. I just want to give those as a background for some of the equity activities. But in terms of going back to the first two, I just wanted to get some thoughts about from the board about these activities.
Do you guys currently use a language interpretation line?
988 does have access to language lines, I believe like over 240 languages for translation.
Okay. And so is your question just about like putting out that information to people so that they know they can have language access? Because if you already have a language service, what are you guys looking to do?
This is not my area of expertise, but there are language access standards that we have that were pretty outdated. So I think we worked across the board to update them for all of our state departments. So there's standards and policies, but one of the things that we hear over and over again from our communities is that 988 services is not entirely easy to access for folks that speak other languages for a number of reasons. And I can't say that we've done a very systematic dive into understanding what those reasons are, but we've heard this over and over again.
I think maybe just with that answer, maybe it is going to be looking into what exactly are the deficiencies so that you know how to address it. And maybe something to look into is some of the new technology that's out there. I know 911 centers are starting to get translation, like AI translation services. That might be something that a technology maybe through what you already have maybe has a benefit or another piece they can add on to it that maybe would be helpful. But again, if you don't understand what exactly the complaint is, it's going to be hard to identify, I think.
I have an opinion on that as far as like the translation is, I think it's just really vetting whichever agency or whomever you decide to go with, because even with a translation service, like it is not great. Like it's from like a 911 perspective, like the next language to English would be, Spanish, the most common. And I speak Spanish, I understand Spanish. I'm not very fluent with it, but I can get to where I'm going and I can get my point across and I can get it done. But just with taking a majority of like in a 12-hour shift, I'm taking like 150 calls myself, and like maybe 30% of those are Spanish speakers, and I'm getting a translator, and the translator is literally not translating what the person is saying. And it's really hard because I literally have to be like, that's not what they said, and that's, that one number makes a difference in sending help to the correct address. And so I think that is part of the frustration, and that's part of, I don't know if that's hitting what you're saying, but it is very frustrating because, and then that's just me who kind of understands the Spanish and stuff like that, but let alone like other languages where I'm just kind of just going off of what they're saying. So I don't know, that's helpful.
There might be a place in the new CRM for this. From the Equity and Accessible Access Working Group, some of our deaf and hard of hearing stakeholders have really identified that they kind of get dropped through the continuum. And so even if they call and they connected to a 988 through an ASL interpreter or video relay services, and then if it goes to mobile crisis, all of that information is dropped, and mobile crisis maybe has no way to like interact with them. And so when these transfers are happening, that seems to be a point as well in some of this. And maybe on the technology or it's different on how that's routed. I don't know the specifics on that, but they really identified that when they call to test out the services and they have trouble getting through the different kind of transition points. And so maybe that's an opportunity where the CRM can really help support some of that.
And thoughts that come to mind for me, I don't know if it's a little outside the technology focus here, is yes, quality interpreting is so important, but I think also from a cultural context, how messages are conveyed also plays a big role in the clear communication of what's going on, particularly around mental health crisis. So I think a lot of what we hear is that, yeah, okay, interpreting when we have to, but the preference is that the person who's responding to the call is actually a native speaker or somebody who is from that cultural community, so that there's more of that connection. So that speaks more to workforce, I suppose, than technology. So that, and that's a hard ask to complete, right? To look at, so that when we think about what could we do, I don't know if it belongs here in this space or another space around recruitment for crisis counselors, people who are answering those calls. Who are we working with? Are we pulling people from underserved communities and training them up to be responders for communities?
I guess one very specific thing I can add to that, on our working group, we have partners from the California Disability Agency, and they asked a specific question about, in the call center themselves, is there technology support to have a deaf or hard of hearing crisis counselor? And that piece I didn't have an answer that I felt confident giving them, because I just don't know what the details are of the different call centers. But So I don't know if you have any information on once the CRM is live, or if this is a possibility for crisis centers to be able to support a workforce and what technology that would need.
I guess I would add that technology could be useful for this type of situation in that certain languages are very difficult to find a translator for us in the 911 center. And I could imagine that it's can be even heightened in certain mental health crisis situations in that it's very hard to convey, sorry, please continue to hold. And if they're in a heightened mental state and you can't convey anything to them and there's just, some type of silence on the line, or you're just still speaking to them in English and they're having to wait for 4-6 minutes, that can be an issue as well.
All right. Any other questions or comments for Dr. Bowie in her update?
Sorry, I just have one more. So I think in order to help that, as far as like, I know that would be a whole nother, like getting specific responses for specific, like, responding Native Americans with Native Americans, or, having specific responses to people responding to the calls. Something that we do in particular, and we could just kind of like did it on our own, is like, so like, for instance, we get a call and it's taking me like 15 minutes to get the information because I'm waiting on hold because I really don't understand. And they speak Russian, and then I get a Russian interpreter, and then I get them on the phone. I get all the information, and no Aliani is coming over. It's this like, we're like 15 minutes into the call, and then our guys responding, they're not Russian speakers. So something to kind of help that, and I don't know if this is something that might help as well, is finding out, like, communicating with whomever is responding and being like, hey, I still have the translator on the phone. Do you need them? And then I'm able to kind of help and get whatever information they need, in person kind of thing. I don't know if that would help as well. So.
I think so from a 911 perspective, I think language translation has been kind of embedded for so long. There's good policy. So I think there's some lessons learned that we can take from there and bring into the 988 world. And as we look at solidifying the translation services for 988, we can take a look at how it supports the 988 crisis counselors, their mobile crisis team. Is there a transfer from 988 to 911? How are we going to transfer that translator as well? Or is 911 going to be expected to get another translator on the line? In the 911 world, we have a statewide contract for translation services. So I think as we've discussed this, the easy button is we write our future contract to include 988 service, and we have one single provider for both systems. So logically, as long as the technology can support the transfer of the three parties, we can transfer the translator, the crisis caller, the crisis worker into 911, and then vice versa. I think there's some technical, my engineer left the room right when I need my engineer to answer the question. There's some technical things that we need to solve there, but I think it's possible. And again, the easy way, one translation service statewide for all services. So then we can establish, I think, better standards for the translation system. And then if we are having issues like you expressed, we have a way to hold that vendor accountable in the contract.
Sorry, may I ask then, thank you for all the feedback. Would this be an assignment that the board can give to the Accessibility and Equitable Access Work Group to look at these two activities on equity?
I think that'd be a great idea. I think you should look into translation service, and you should look into any kind of AI they do language detection. I know that the company that you're getting, NGA, I know that they have in the 911 space a component to their call handling solution that does automatic language detection, translation, transcription. I don't know that you need all of that. And again, it comes down to how much do you want recorded? But the AI is out there. Our officers just deployed body-worn cameras that allow for automatic language detection and translation in the field. That is with a camera. I don't know if you'd want a camera piece for mobile crisis response teams, but we're getting great feedback about the ability to talk into their camera and then it translates, and it's pretty good translation that they're getting, and there's like 50-something languages. So a component like that might be something to look into as well for your mobile crisis response teams.
Okay. So I think there's some action items for your group. And then on the translation services, we'll engage my team and we can share what we do on the 911 side for translation. That contract is public, we can share that. And then I think for translation services, we can start to develop what are the needs on the 988 side so we can embed that. And I think that contract comes up at the spring of next year. So this might be just the right time to develop all of those requirements.
Can I add one more thing for their working group? Make sure in the contract when you talk with Cal OES, make sure you get some sort of video ASL interpretation written into the contract, because we don't have that now. And we're finding that would be incredibly beneficial to have.
ASL for the dispatcher crisis worker or for the field responder?
Both.
Okay, so we should have that embedded in the current 911 translation. It doesn't extend to the first responder, but it should be there.
I was told by the state provider that we do not have ASL video service this week.
Sammy, can you make a note for us to check with Nina on that contract, and we'll validate that. We'll take that as an action item because we specifically wrote in video ASL.
Great, thank you. I appreciate that.
Yep. Yes. Yeah. I want to qualify. If your agency's using the state's contract for translation service, there are some entities who don't take advantage of the state contract. They hire local translation services. We do have one agency. I can't remember exactly how many languages the state has on contract, 197 or something like that, to include ASL. Some agencies opt to do a local contract, and that's their option. But the state does pay for 911 translation service. So we'll get clarification on that, and we'll make sure that that's included in our 988 side if that's the direction we want to go.
Oh, sorry, I'm taking down all of the notes from your wonderful feedback, so I got distracted. So just in terms of what we're doing this coming year, lots of work is being done with an eye toward the first mandated deliverable, which is our first annual report on 988 implementation, is due to be public end of this fiscal year, June 30th, 2026. And if any questions or if you need more information, those are the websites and email contacts.
Thank you, Dr. Bowie. All right, the next item on our agenda is review of the 911-988 transfer guidance document. And this was an agenda topic already on the agenda. So from our previous conversation, I'm going to feed this into our branch update and have this come through as a part of the branch update. And our goal will be to get like a first iteration of a drafted transfer document to you ahead of the November meeting, give you time to review so we can come and have a discussion at our November meeting about this transfer document. And again, we're going to work with the working group. The benefit of the working group is we can give them feedback. They can work with the state team. We can get an edited document turned around and pushed back to the board. I think a little bit easier, and then we'll work with Dr. Bowie and the working group that she has to see how we gain the larger feedback on that document. And we'll come back with how we're going to address that at the future meeting.
So I have a question, Paul, based on the public comments at the beginning of the meeting, was that there were not enough involvement from the community and stakeholders and so on. Despite the proposed draft document has been posted on COES website for more than a year now, and seeking feedback from various stakeholders, community groups, as well as feedback provided by the board. But then my next question is whether if there is another way or a more effective way or sufficient way to inform those that would like to attend the work group to provide additional feedback before the board have the so-called, I wouldn't say final review before approval, but another review for approval, because otherwise it will be going on and on forever. So I mean, would it be sufficient to just put the meeting date and time agenda on the COES website, or is there other way to inform communities about this meeting?
Yeah, thank you, Lon. Very good question. This is a question I need to take back to my leadership and my legal team to find out. The working group is a working group, and we need to find out how do we address gaining the public comment, how do we address all of the needs. So I would say, let me take this back. Let me get some feedback on how we're going to solve this moving forward. Okay. Our next topic is agenda items for future meetings. Our next meeting is scheduled for November 20th here in this room, and then we have published our 2026 meeting dates. I do want to remind everybody, these are targeted like calendar placeholders, and I believe Sammy, our board liaison, will get those sent out to block your calendar for these dates. If there is an event or something occurs where we can't meet on that day, we do have some flexibility to move them, but we just want to target and get everybody thinking about the important work that this body does and get those calendar out for the next year. But are there any agenda topics that we need to add for our November meeting? All right. Is there any public comment for matters not on the agenda? All right. Hearing none, we are adjourned. Pretty good timing today, 12 o'clock. Thank you, everybody, for attending. I appreciate all the conversation.